I thought this was just a coffee morning, but it's actually about something called CLEVES.
That's right. It's MPFT's new approach to making sure people like us help shape health and care services.
Not just doctors and managers, but young people, carers and people who have used our services too.
What's MPFT?
That's the nickname of the organisation I work for, Midlands Partnership University NHS Foundation Trust. They provide lots of different health and social care services for people of differing ages in many different places.
I've heard of them because I've been caring for my son for 20 years. It's exciting to think that carers like me could help design the services we rely on.
Okay, I'm interested. So what does CLEVES actually mean?
CLEVES is another nickname. We like them in the NHS. It stands for Co-Production, Lived Experience and Community Voice Strategy.
It's a 5-year plan to make sure everyone's voice, especially those with lived experience, helps shape how our services are designed, delivered and improved.
But what does all those jargony words mean, really?
Okay, let's break it down. Co-production means working together. Not just asking people what they think, but involving them in designing and improving services. Lived experience means people who've used services, like me. Share what it's really like and help shape better care. Community voice means listening to everyone. Families, carers, young people and communities, especially those who don't always get heard.
And it's all built around 4 big ambitions. Think of them as like puzzle pieces that all click together to make the CLEVES picture. We decided on them by hearing ideas from lots of people who work in MPFT or have used the Trust services. Some of the people had a friend or family member who had used these services too. Here, I'll talk you through them.
First up, we want to foster a culture where lived experience is valued. That means making sure people feel safe to speak up and that their insights are respected.
We are thinking about masterclasses and other training to embed co-production into leadership development. We want MPFT's leaders to have all the skills they need to feel confident working with lived experience representatives.
We know clear communication matters, and a picture can say 1,000 words. We want to develop new, creative ways to share stories that highlight that lived experiences can influence change. We're excited to meet new people, including those who may be unsure about working with us or haven't had good NHS experiences before. We'll work with community leaders to build trust and plan more in-person meetings at times that suit you.
By year 5, we want to work with other organisations to coordinate efforts and stop recreating the wheel. That means only asking for you and our communities for your stories once. Where there's a few of us in one area wanting to work with local people, we'll try to think about the idea of lots of organisations, one community, and have shared approaches.
What's ambition number 2?
Embed lived experience in everything we do. That means involving people with lived experience in all areas of our work.
We're looking at mapping the brilliant things happening in our communities, finding what communities need and how we can connect.
That'll lead to new partnerships between staff from frontline services and grassroots groups who hold real wisdom about what the best care could look like.
And we're working on a payment policy that lets people choose how they're paid for their time, whether that's money, vouchers or volunteering.
I'd love to help run a listening event in my neighbourhood. We could gather feedback and see it reflected in what MPFT does. Not just collected, acted on.
What's the third ambition?
Measure, map, share and spread what works. We want to make sure feedback leads to real change and that good ideas are shared across the Trust.
There could be a student council at the Wellbeing and Recovery College. Young people like me could help design the courses. Maybe even create a session on body confidence.
We are also exploring ways to measure how lived experience voices influence the research MPFT does. so that new ideas about what to research and how are grounded in real people's perspectives.
We're planning to use digital platforms which everyone can interact with to regularly record and share how people are involved and working together with our communities. We'll capture the impact the work is having. Sharing what's happening and where it's going well will make future efforts even more impactful.
As a lead in lived experience practice, I'm excited about making a difference nationally and representing MPFT in conversations about the wider field of lived experience, co-production and health and social care.
And what's the last ambition?
Make MPFT a brilliant place to work, especially for people with lived experience and those who are working to ensure communities' voices are at the heart of what we do.
We'll embed lived experience voices in all of our MPFT teaching and activities. And our Wellbeing Recovery College shows that hearing from people who've walked the walk drives real change. We're excited for students and staff to learn together in co-produced classrooms.
I used to think I'd never work again after I became unwell, but I'm proud as a peer support worker to be a part of a team that values my experience, with proper supervision, training and a clear path to progress.
I want to become a co-production ambassador for my service because I've seen how this role improves care in the workplace. I'd love to collaborate with people on my caseload to create positive change. I know co-production can create opportunities for patients and people who care about them.
We think if we can achieve the 4 big ambitions, we'll be delivering even better care and improving life for all of our staff, as well as the communities that MPFT serves.
Sounds pretty good.
I love that people want to tell their stories in order to help others.
And that we can help too.
To read the full CLEVES strategy, find out more about the journey of us developing this work and share your thoughts, please visit the website.